Hi dear students, welcome to Dental Amaze Academy, and today in this short session I'm going to discuss with you four very important pillars for NEET, INI-CET, MDS entrance preparation. I'll also tell you why you should choose Dental Amaze Academy for your destination to reach your dream seat in a government dental college. Okay, so let us start right away without wasting any time. Now you could see here four pillars of MDS entrance preparation. Four pillars of MDS entrance preparation. Whatever you get, if you don't get these four, you are not going to get the right thing from anywhere. And if you don't follow these four, then you are going to be in a loss. Please understand, dear students, getting into NEET or AIMS is not rocket science. You can get there, but with proper guidance, what you should be getting what it deserves to get. Okay, it is not like you're getting lots of contents and you are studying lots of contents and you think that you're going to get through, because you know around 20,000 students are writing, roughly 20,000 students are writing the exam, of which 10,000 students are going into various coaching centers in India, unfortunately, but the seats you have is only 250 to 300. So why is it that this 10,000 students are not getting through? Not that they are not getting the contents, not because in many institutes you get the first rank holder and the last rank holder. So what makes the difference? What is the most important thing which you should focus when you are preparing for NEET MDS? Also, these are the four reasons why you should select Dental Amaze Academy for your entrance preparation for the upcoming year. Okay, now let us start. What are the four things? One is understanding the basics and concepts. Second is systematic learning. Remember, these two are two different things. I'll explain it to you. Third is the revision. Okay, as you all know, revision is the key, but how to revise, that's the key. When to revise. So these are the few things I'm going to tell you today. And finally, there is one thing which completes all these three, which I will tell you in the end. Let that be a suspense, isn't it? That's the most important key. If you don't have that, if you don't get that, then definitely you are not getting the 50%. Okay, the rest 50% makes the three of it, and the final one makes the 50% is what I believe. Okay, and what is true. Now, understanding the basics and concepts. Now, considering the new pattern of examination, if you don't understand the basics and concepts, getting a good seat becomes almost impossible, because you get lots of new questions nowadays. If you don't understand the concepts, see, people, what they do is they roughly go through various MCQ books and they go for the exam. Yes, around 130 to 150 questions are, you get it like direct simple questions, but this doesn't decide your seat. The actual seat is decided by the next 30 to 50 questions which revolve around the basics. Okay, yes, they are little hi-fi questions, but they are not, it's not that they are not approachable. It's not like that. They can be done. Only thing is your basics and concepts has to be clear. Now, I'm not saying that the first 150 questions doesn't require basics and concept clearing. But yes, if your basics are clear, getting that 150 questions becomes much more easier than you are simply attempting various question banks. Okay, and again, I'm not saying that you shouldn't attempt question bank, but the thing is that whatever you are learning, you should be learning with your basics very much clear. You have got 20 subjects to learn. And if you are not clearing your basics, that's going to be a big problem, because one question, just consider two questions on basics, a little bit, clinical scenario based or application level questions, two questions per subject, it becomes 40, isn't it? And you know how much basics and concepts are included in each subject. Okay, I don't need to say you. Now, secondly, as you could see there, systematic learning. This is where Dental Amaze Academy specialized at. You ask any of our students, we go through the basics, we consider them in a systematic manner. Why is this important? Because, so you are learning 20 subjects in 10 to 12 months. So yes, if you're learning any MCQ books, you can learn it, but when you're learning like randomly from an MCQ books, the problem is that recollection, retrieval becomes problematic. Okay, and you know that when you're learning so much subjects in 1 year, you have to keep it in a very systematic order to recollect things. If it is very randomly arranged, you don't know from where this question has come. You don't know from which topic the question has come. If you don't know like that, the problem is that retrieval becomes very difficult. As you all know, you get 40 to 45 seconds, isn't it, for reading a question, reading the options, retrieve what you have learned and arrive at an answer. So what many students make mistake, one, they don't do systematic learning. As a result, they don't know what this question is all about. They forgot, because they're recollecting from where? They're recollecting from 20,000 questions, isn't it? A book which contains 20,000 questions, they're recollecting from there. So it becomes almost impossible. Secondly, they waste more time. So 10-15 seconds extra for each question, just imagine. So this is where systematic learning is going to help you. Okay, there are a lot more to say about systematic learning, like intelligent guessing. If you have learned it in a systematic manner, guessing intelligently, a knowledgeable guess, I'm not talking about blind guess, guessing intelligently is the key. Okay, now the next thing is, you could see there revision. Okay, now see, people think that I'll finish everything. Some students call me and ask me, when is the syllabus going to get finished so that we can start revision? Now please understand, dear students, revision doesn't happen like that. It is not that you finish your entire syllabus by September and you start revision. By the time when you start revision at that phase, the problem is that you would have already forgotten what you have learned. So the revision should start right away from the first 4 subjects are over. When first 4 subjects are over for you, the revision should begin. Otherwise, what is going to happen is you're going to forget what you have learned previously. So that should not happen. Very, 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 very important. And we have a strategy. We call it as continuous revision strategy, CRS, where we start right away and we finish it in a very beautiful manner, so that, yeah, definitely no student is going to go for the entrance examination with full confidence saying that I've learned everything. So that's not possible, but it makes you stress free. Okay, you finish it in a very systematic order. Make sure you join early. Not that I will join in the last 4 months and I'll get everything. No, you have to make sure that you're joining early so that you get the best out of it. Okay, so what are the 3 things? One was basics and concepts. Okay, the second was systematic learning. Third was revision. And finally, what is that? What is the most important thing which you should keep in mind? Guidance. Okay, and guidance from the people who have done it previously, because you are passing through one of the most difficult phase of your life, where maybe you are an intern, so you have to manage your college as well as your entrance preparation. So how to do that? One, or you are a pass out and you are not going for work, you're not concentrating, you're not going to clinics. So how to manage things out there? Okay, so because lots of things you are into pressure. Secondly, certain students run the clinic and then do their preparation. So how to manage them, when to stop your clinic, for how long can you go to the clinics? Okay, all these are very, very important, because certain students think that I will just simply do some particular dental pulse or dentist or like that, or whatever, because there are wonderful books out there. But yes, people think that I'll do that in the last 4 months and I get to. It is not like that. It is so competitive. But yes, it is very much practically possible to get in if you get the right things in the right time, in the right place. If you do that, it's not going to be a problem. But if you do it in the wrong way, then it's going to be a problem. That is where guidance is important. Now see, another important thing where guidance is required, like which books to refer. You have 20 subjects in front of you, isn't it? So 20 subjects to refer. And so how to learn them? How to read textbooks? So should I read textbook? How much? If yes, how much should I read? What should I refer? That's very important. Next is like guidance is plays a very important role. Like you are in different phases. When you start, you will be thinking, you'll be having a different thought process, but in between, in the center, in the middle part of it, you'll have a different thought process. But at the end, you'll have a different thought process, which will mixed up with stress. Okay, you feel like, oh my God, I did a mistake like this. Yeah, sir told me to do this, but I didn't do this. So how to manage this? So, and yes, as you go on, stress builds up, and there should be a methodology to bring down this stress. I call it as positive stress. Negative stress, we have to bring it as much as low as possible, but there should be a positive stress. There should be that adrenaline rush which makes you read, which makes you learn, but not the negative stress. Then yes, to keep that motivation going, because I have seen many students who join the academy with lots of determination, but the problem with them is that they don't maintain that determination. So how to maintain that determination throughout the year? What is overdoing? Certain students make a big mistake of overdoing things. So what is that? How to manage those things? How to keep the positivity going? How to keep the motivation going? What are the steps you have to take to keep the motivation going? So all these are key things which comes under guidance, and this is why I told you, without guidance, even if you get anything and everything, it doesn't work out. Certain students, they select an academy based on how much notes you get. Okay, yes, we do provide notes, but yes, some students think that if one coaching center is giving you 5,000 pages of notes, another coaching center is giving you 1,000 pages of notes, yes, the 5,000 pages notes academy is better. No, please don't make this mistake. See, it is not that how much you are getting, it is that how much you can learn. And yes, if you're getting thousands and thousands of pages of notes, and for learning 10 pages of notes you're taking the entire year, just divide it and see how much time you're going to take them. And yes, definitely there has to be multiple revisions, at least 4 to 6 revisions, at least. So will you be able to? So this is what we do for you. We simplify things for you. We give it to you mostly in the form of lectures, which simplifies things. You listen to a lecture, 45 minutes of lectures, done. That portion is done for you. It is not that we give you a presentation, PowerPoint presentation, which contains lots of knowledge, lots of bombardments of knowledge, and you are taking the entire day to learn it, and finally after 2 days you forget. No, that is not the methodology we follow. We follow the methodology where you learn it right away so that you can save a lot of time and advance. Please understand, what you get initially is the basics. Once you build up the basics, you can advance to any higher level. So your basics should be quickly finished off. Then you have to advance it much faster. Many people make the mistake that they think that I will do everything. I'm going to get 5,000 pages of notes, so I'm going to do everything. And finally, they finish ortho, pedo, OMFS, general medicine, and then they look back, ortho, everything is gone. Okay, so that is, please don't make such mistakes. I know there are lot more to say, so please attend the next orientation session. Go to our website, go to the courses section. There is orientation session. Okay, click on that. You will see the next orientation session date. I know lots of things have to be said. I'll say that in that. Very importantly, see, one thing just I want to close it on is that the learning process. The learning process for NEET MDS and the learning process for your BDS examination is completely different. Not just NEET MDS, even AIMS or INI-CET MDS. It's completely different. So if you're following the same methodology of learning the BDS examinations, then you're going to get into trouble. So what is the difference? Well, I'll give you a simple example why it is really different. In BDS, the answer you have to derive. There is only question. You have to derive a huge answer. Whereas in MDS entrance examinations, answer is in front of you. Isn't it? Answer is in front of you. Out of the 4 options, one is answer. So the learning process, the retrieval process, everything varies. Just one example. There are different reasons for this. Okay, so what is important is photographic memory and retrograde analysis. This I'll discuss in the orientation session. What is photographic memory? How to build up photographic memory? What is retrograde analysis and why is it important? All these are connected to systematic learning. Okay, so that's it. Hopefully, if you want any information, go to the websites. There are contact numbers, contact them, get more details. And one thing I can assure you, if you join Dental Amaze Academy, you are never going to regret, provided you are someone who's going to give his or her best. It's not like you come in and you're going to be like just sitting there and thinking that in the NEET, no, it's not. Lots of effort required, lots and lots of effort required. Okay, so effort is required. So please make sure you are determined before coming in. You should not say that, sir, I'm not able to give time for that. No, you have to. If you want a seat which gives you 55,000 per month and even 1 lakh per month just for learning, you are being paid 55,000, 50,000 to 1 lakh. The effort is going to be required, but what you're going to get is guidance. It is like, I give a typical example that between the difference between rotary files and hand file, or the stainless steel files and nickel titanium files. Okay, the nickel titanium files do the job for you. You don't need to do anything else. You just need to insert it and take it out. It does the job for you. That is what Dental Amaze Academy does. You have to go in. Rest we will do it for you. Whereas self-preparation means it is like stainless steel. You have to rotate it, you have to use different types of forces. Okay, balanced forces, that forces, this forces, K files, all those. So you have to do all the work. Here, we'll do the work for you. Or we will do the guidance for you. We'll guide you, the tapered preparation, isn't it? We'll guide you and we'll give you everything what is required. You just need to give your effort. Okay, so I'll stop it here. For more, you just go onto the website, get into the orientation session, check the dates, attend it. It's mostly, all of the time it is on Sunday, so it's not a problem. You can attend them. Okay, all the very best for your preparation and take care.